Welcome to the webinar, Why and How to Sell Medicare. We're Flexible Benefit. My name is Larry Kassman, Sales Manager of Individual and Medicare Sales. We'll go over the reasons why you should be in the Medicare market. So who is Flex? We'll go over the exploding Medicare opportunity, understanding Medicare, Medicare supplements versus Medicare Advantage plans, sales strategies for success. We'll do a case study, group versus individual insurance, and then Medicare certification, why work with Flex, and then final comments. Market trends, why sell Medicare? Medicare is the largest potential growth market out there today. Because of the baby boomers, we have an aging population. There are changes in retiree health care. These baby boomers have a lot of wealth, but there's a lot of confusion, so it's a market full of growth. Did you know, in 2011, the 77 million members of the baby boom generation began turning 65. Boomers are turning 65 at the rate of over 10,000 every day for the next decade. That means one turns 65 every 8 seconds. The Medicare eligible population will continue to grow. By the year 2030. 1 out of every 5 Americans will be age 65 or older. That's 20% of the population. And seniors control nearly 75% of the wealth in the United States with a staggering $7 trillion. Why the Medicare Plus market? If you can see the two graphs here, look at the one that's over 65. If you look at 2010, how that line goes almost a nice diagonal there. More people are living past age 65 as years go by, and even age 85 and older. More and more people will be age 85 and older, so people are living longer, and their biggest fear is outliving their money. It's the most underserved market, which means for every 185 Medicare supplements sold, only 1 is sold by an agent. For Medicare Part D, standalone Part D drug plans, for every 2,250 policies sold, only 1 is sold by an agent. And for Medicare Advantage plans, for every 4,090 policies sold, only 1 is sold by an agent. The fear is real. A 65-year-old couple retiring in 2013 can expect to incur $220,000 in medical costs during retirement. The unpredictable cost of illness and healthcare is by far the baby boomers' biggest fear. 54 million enrollees as of December of 2014. 30% of these people are still on an employer-sponsored plan or a TRICARE plan. 31% are on a Medicare Advantage plan, 15% in a Medicare supplement, 9% have no supplement coverage whatsoever. That means they just have Medicare Part A and B, which means that they are responsible for 20% of all their costs, and that could be unlimited out of pocket. 14% of the people are on Medicaid. Closer to home in the Illinois market, over 1.9 million Medicare beneficiaries, but 1.1 million are in the Chicago metro area alone. In Illinois, 393 people turn 65 each day, but in the Chicago metro area, 212 people turn 65 every single day. Nationally, in Illinois, 32% of the population in Illinois have a Medicare supplement, while only 10% have a Medicare Advantage plan. Understanding Medicare. Original Medicare is on the left. There's Medicare Part A, which helps with hospital costs. Part B, which helps with doctor and outpatient care. Part D is a standalone drug plan that covers prescription medications. And then there's a Medicare supplement that covers some of the financial gaps that Medicare Part A and B do not cover. Then on the right is Medicare Advantage plans, also known as Part C plans, which they combine hospital, doctor, outpatient care in one plan. They also include a Part D drug plan. Most of the plans do cover it, some do not. And there are also additional benefits often included, such as vision and hearing services with Medicare Advantage plans. Selling Medicare policies. to sell a Medicare Advantage plan, MAPD, you must both have to sell for Medicare supplement and MAPD options are in your arsenal. You must have both of those to sell. Different products equal additional choice, which means more sales for you. Medicare Advantage quick facts. Nationally, about 50% of the beneficiaries choose this option with all carriers. Major carriers typically offer 0 to low monthly premiums. Commissions on MAPD plans are typically higher than Medicare supplements. There are compliance requirements that can be learned. Flex will offer compliance training for you in late summer and early fall. Medicare supplement quick facts, usually good alternative for beneficiaries who travel frequently, don't want a network, who are in ill health, and do not want or need additional benefits that are typically embedded in a Medicare Advantage plan. Commissions. On a Medicare Advantage plan, the first year commission is $429 in 2016, but in 2017 it went up to $443. Renewal commission is about half. For 2017, it's $222, and these commissions are set by CMS, the Center for Medicare and Medicaid Services. Medicare supplement commissions, first year commissions average about $200, and the renewals vary by carrier. Those are based on a percentage, anywhere from 10 to 18% depending on the carrier. Prescription drug plans are also set by CMS. First year commission is $71. Renewal commission is $36. So selling Medicare, there's a couple of approaches you could do, the high to low. High is a plan F, or down to the plan G, plan N, high deductible F, or a 0 premium MAPD plan. These have higher fixed costs or higher premiums, but there's lower out-of-pocket costs. So if people want to be safe, they want to know that they're going to be paying a certain dollar amount in premiums every month and don't have to worry about out-of-pocket costs. You start with a plan F, then you go to a plan G, N, and then high deductible F or a 0 premium Medicare Advantage plan. The low to high approach is sell a 0 premium Medicare Advantage plan. If that doesn't work out, a high deductible F is an option, N, G, or an F. They have lower fixed or premiums associated with those, but they have variable higher costs, which means they would have copays for every service that they have, and there is a limit to their max out-of-pocket as well. So high to low, Medicare annual out-of-pocket could cost you over $57,000 or more. Unlimited Part D coinsurance, limited coverage for hospitalizations beyond 90 days. So if you have Medicare Part A and B, that's what you'll be hit with. That's why you need a Medicare supplement, such as a Plan F, which is the most comprehensive Medicare supplement plan you could get. So the Plan F would cover that over $57,000 out-of-pocket cost. It covers the Part B coinsurance, so Medicare Part B pays 80%. The Medicare supplement will pick up that 20%. They also cover excess physician charges, so if a doctor does accept Medicare, he is allowed to charge 15% more than the Medicare eligible charge, and the Plan F would cover that extra 15%. It provides additional hospital coverage and also provides emergency coverage overseas. That's with a Medicare supplement. The low to high, the low being a lower deductible, a lower premium or a 0 premium plan, Medicare Advantage plan. Typically, it has a $3,800 out-of-pocket maximum, but to reach that out-of-pocket max, you have to have 7 days in a hospital, 20 days in a skilled nursing facility, 9 PCP is a primary care physician visit, 1 special visit to a specialist, 2 ambulance rides, 5 lab tests, 5 x-rays, and a $2,000 outpatient surgery. So as you can see, it takes a lot to reach that $3,800 out-of-pocket maximum with a Medicare Advantage. Medicare Advantage plans generally also include some no-cost services for the member, such as an annual physical, cardiovascular screenings, cancer screenings, diabetic testing and supplies, and home health care. On the left, typical Medicare Advantage plans include these benefits. On the right is the original Medicare. So some of the things that are included would be podiatry services, vision, hearing, dental, health assessment call, a 24-hour nurse line, and optional riders as well, where original Medicare does not include any of those extra services. So let's take a case study. Today, many people are working beyond age 65. Helping these individuals make the right insurance choices will vary based on the unique circumstances of that person. This is not one size fits all, so you have to get to know your client and see which of these plans will be the best fit for them. This is increasingly important for those people working for employers with less than 20 employees, as Medicare will now be the primary for these individuals. So if somebody's on an employer group plan and there's less than 20 employees, they must get Medicare Part B, which is the doctor's portion, because Medicare will be the primary. That means Medicare will pay first, and their employer group coverage will pay second. Now, the employer group coverage will only pay the 20% because they assume that you have Medicare Part A and B that pays at 80%. So it's imperative that you tell your client if they want to stay on a group medical plan, employer plan of less than 20 lives, they must get Medicare Part A and B. If the employer group plan is more than 20 lives, Part B would be optional and there would be no need for that. So the group health plan in this case study, from 2 to 19 employees, so the total monthly premium is $550. And the employee is paying 50% of that premium, which is $275. There is a $2,000 deductible with that plan. It's an 80% plan. There's an additional $1,500 out-of-pocket cost. There's a $20 office visit for a copay. The drug card has either 10, 30, or 50 copays for the drugs. And let's assume the employee averages about 4 visits per year to the doctor and takes 1 generic and 1 preferred brand. Let's see how that group plan stacks up with the other Medicare plans. So the premium comes out to $3,300 per year. They would also have to get that Part B at $104.90. That comes to $1,259 a year. They need to get that Part B as well, which is the doctor's portion of Medicare. Let's say they have 4 office visits at $20. It's $80 for the year. And then their drugs cost about $480. That means their annual cost will be about $5,100 if they stayed on that group plan. So let's assume, instead of taking the group plan, let's assume they decide to come off the group plan and get a Medicare supplement with a standalone Part D drug plan. They still have to get that Medicare Part B premium of $104.90, pay that every month. It comes to $1,259 per year. And then they're going to get a Plan F. The premium is about $149 or $1,788 per year. There's no copayment. Every time they go to the doctor, they would not have to pay anything with the Plan F. Their Part D, there's a premium of $39 per month. It comes to $468. And let's say with those medications, they'll be paying a total of $564 per year. You add all that up, it comes to $4,079. It's $1,040 less than staying on the group plan. As you can see right there, they were paying $5,119 if they came off that plan and went onto a Medicare supplement and a standalone Part D drug plan. They would pay $4,079, a savings of $1,040. So let's assume this person decided to get a Medicare Advantage plan that includes a drug plan built into it. MAPD stands for Medicare Advantage, PD stands for the Part D. They still have to have that Part B premium, which is $1,259 for the year. It's a 0 premium on this Medicare Advantage plan. The Part D is built in, so there's no premium for that. There's a $5 copay for office visits that comes to $20 per year, and their drugs would cost about $612. So that comes to $1,871 if they were on a Medicare Advantage plan compared to the company group plan. So in this case, they would save over $3,200 compared to the group plan. Now, one thing to keep in mind with Medicare Advantage plans, even though they have 0 or low premium plans, they are network-based. Most of them are HMOs, which means you will not have any out-of-network benefits. There are some plans that are PPOs that have some premiums of about $74 or $79, and they do have out-of-network benefits, but there is a cap on those. of about $5,000 to $10,000 if you go out of network, but at least there's a cap. Same scenario. Let's assume the employee was in a major accident and accumulated about $50,000 in hospital bills. So Medicare will cover all but $1,216 because that's a hospital deductible. Under the group plan, the employee would pay an additional $1,043. So their cost would be the $5,119 that we saw before, plus the additional $1,037, which is their deductible and coinsurance, for a total of $6,156 at this date on the group plan. Under the Medicare supplement and standalone Part D drug plan, the employee would have no additional cost, so they would just pay that $4,079, a savings of over $2,000 compared to the group plan. And let's assume they had a Medicare Advantage plan. They would have about $1,750 in additional costs with copays, because when you go to a hospital, there's a copay per day for up to 7 days. Originally, this person had about $1,871. Add on that $1,750 for a total of $3,621. It's still a savings of over $2,500 compared to that group plan. So the thing to come away with, if somebody's on an employer group plan and it's less than 20 lives, they must look at other Medicare options, a Medicare supplement or a Medicare Advantage plan and a Part D drug plan. In most cases, they would be better off and save quite a bit of money if they came off and went on Medicare. And also, the one thing to keep in mind is that the employer itself, by having that employee come off, they just lowered their group insurance premium as well. Lifetime cost savings with a Medicare Advantage plan. If you look over a 17-year period from age 65 to 82, the average premium is about $243 for a Medicare supplement and $30 for a Part D drug plan. That is a total of about $3,276 in annual premiums. Max out of pocket with a Medicare Advantage plan is about $3,800. So over 17 years, the total save with a zero premium plan for your client would be about $55,000. People are living longer and they need their retirement funds to last longer. If you don't sell Medicare Advantage plans, or at least mention it, another agent will. Medicare Advantage plans aren't for every client, but it's a good option and something that should be addressed with your client because it might be a good fit for them. Medicare certification is coming up. It starts June 27th this year. You start off by doing the AHIP certification. It's required for most carriers. It covers the basics of Medicare, and it usually covers fraud, waste, and abuse, Medicare basics, and rules and regulation. You must pass that AHIP exam. Don't wait. The sooner you get contracted and certified, the sooner you can start helping people and get actually paid. Their certification is if you want to sell Medicare Advantage plans or Part D drug plans. There is no certification required if you want to sell Medicare supplement. Here are the certification links for the AHIP, which starts June 27th. It's ahip.medicare.com/ext/ahip/login/php. Your login will be your NPN number, and you have to create a password as well. The Blue Cross certification will start after that, usually around the 1st of July, and it will be on Compliance Wire. Once you do your AHIP certification, it gives you options where to send your certification scores to which carrier. Once you do the AHIP, there'll be a drop down. You can pick Blue Cross or what other carriers you want to sell, like United Healthcare, and your scores will be transferred to that carrier. And then a couple of weeks later, when you want to do the carrier-specific training that you have to do to sell their product, like Blue Cross or United Healthcare, your scores will be transferred and you'll get credit. And that will make the certification for that carrier much shorter. For United Healthcare certification, you go to www.unitedhealthproducers.com. Let's talk a little bit about compliance best practices and compliance tips. There's a couple different types of events which are educational. It's designed to inform Medicare consumers about Medicare Advantage, Part D drug plans, or Medicare programs. You do not steer or attempt to steer or sell consumers towards a specific plan or limited number of plans. when you do an educational event, you do not have to get it approved by CMS, which is the Center for Medicare and Medicaid Services. Sales events you do. Anytime it's designed to steer or attempt to steer consumers towards a plan or a limited set of plans, you must get that okayed by CMS. And if you do get it okay, then agents may discuss plan-specific information. CMS considers one-on-one individual appointments to be sales events. These appointments are not reported to the plan or to CMS as an event. So there's something called a scope of appointment. When you are going to see a client in person, they must fill out the scope of appointment. You must wait 48 hours after they fill it out to go see them to talk specifically about Part D drug plans or Medicare Advantage plans. To see somebody in person just to talk about Medicare supplements, you do not need that form. There's two types of sales events, formal and informal. Formal is typically structured in an audience. There's a presenter style where you're talking to an audience. Informal is something where you have a table or a kiosk, etc., or a booth, and people come up to you asking for information. And why work with Flex? Here's the roadmap, Medicare roadmap for success. First, you have your health and life course. You must be a licensed producer in Illinois. You must get contracted with the carriers. For Medicare, we have Blue Cross Blue Shield, which has Medicare supplements, Medicare Advantage plans, and Part D standalone drug plans. AARP, United Healthcare Medicare, is Medicare Advantage plans, Medicare supplements, and standalone Part D drug plans as well. We also offer Mutual of Omaha, which offers Medicare supplements only through Flex. And then there's a Part D drug plan SilverScript that we offer also. And then you must take your AHIP course and exam. Then you must do, a week or two later, you must do your carrier certifications with SilverScript, United Healthcare, and Blue Cross Blue Shield. And we have the trainings like what you're watching right now. We have recorded webinars on our website. We will have the ABCDs, or the basics of Medicare. We'll have one on new to Medicare, now what do you do now? The one you're watching is the how and why to sell Medicare. We will have a Medicare marketing workshop, a lead generation and business planning workshop, and low-income subsidy recorded webinars on our website very soon. Final thoughts. Decide your strategy for selling Medicare. What carriers will you offer? My recommendation is offer at least two major carriers, that is Blue Cross and United Healthcare. What products will you sell? Offer both options under Medicare, the Medicare Advantage and the Medicare Supplement. It's easy. Once you're approved or appointed with Blue Cross Blue Shield, you don't have to do a certification for Medicare Supplements. A lot of brokers just sell Medicare Supplements. But it gets kind of awkward when your client says, okay, I want a drug plan, and you have to step back and say, you know what, I didn't certify to sell a drug plan. I'm going to have to refer you to Larry Kassman at Flexible Benefit. And then people will ask, well, why didn't you certify to sell a drug plan or Medicare Advantage plan? The best thing is get certified to sell it. When you take these certifications, you'll learn a lot, and you'll be helping your clients as well. And if your client thinks that you're not well educated on these products, they might not use you. You don't look good in their eyes if you're not fully educated on the Medicare products. So what sub-demographic will you focus on? Do you want to just focus on people turning 65? There's an AEP, which means every year there's an open enrollment from October 15th to December 7th. For January 1st effective dates, that's when people could switch their Part D drug plans, switch their Medicare Advantage plans. Medicare supplements are year-round. All enrollment periods to capitalize on the ever-growing Medicare opportunity, which means if somebody's losing group coverage at turning 65, there's opportunities throughout the rest of the year where people could sign up for different plans, and it's best to be educated on all the plans so you could offer them to your clients. Marketing tip. What's the most important thing you can do in terms of marketing? Tell people that you sell Medicare. Use the 3-foot rule. Anybody within 3 feet, just say, you know what, I sell Medicare. I sell all the Medicare plans, Medicare Supplement, Medicare Advantage plans, and Part D drug plans. When you help out somebody who's Medicare eligible, they are very loyal, and they will tell their friends about you. The word of mouth is fantastic, and you'll just grow your business that way. We have marketing materials available to you to help you get the word out. Thank you very much for attending this webinar. We will have more coming forward.